I'm Peter O'Halloran and I'm the Chief Digital Officer for the Australian Digital Health Agency. Historically, Australia has used a variety of standards, often homegrown ones, which has caused us huge problems as we've gone through trying to standardise our healthcare system. And so over the last 10 to 15 years, we've been working with GS1 really to look at how do we move to global standards that will enable us to exchange data seamlessly, but also to ensure that patient safety is front and foremost of everything we do. As part of this work, we've moved to adopt standards such as identification of people, of places and of items. And this means, for example, that during COVID, we could identify exactly where and when a contact occurred through the use of global location numbers or GLNs. And now it also means that we can trace individual products or medical devices that are implanted into a person through the use of the GTINs, the Global Trade Identification Numbers. And really we've seen this has been a huge change for us as we moved away from the idea that Australia had their own single, unique standards that worked well inside Australia, but meant as soon as something happened overseas, we couldn't share data, we couldn't send products overseas, we couldn't work with international software vendors, to now we're at a position where we're using international standards, and particularly GS1 standards, to help us as we share patient data to enable digital innovation in the Australian healthcare system. I'm really excited about what we're doing with standards in Australia, and it's been a massive focus of the work we're doing. And we're already seeing real benefits as we move to global standards. We're seeing international software vendors who are much happier to work with us. We're seeing local software vendors who can also actually sell their products overseas. But most importantly for clinicians and healthcare consumers, it means that their data is safe. It means that we can ensure that they are uniquely identified and that the products that they get are uniquely identified. This sounds simple, it sounds easy, but as all of us who work in healthcare know, it never is. And so by the adoption of GS1 standards, we have managed to really move the dial in Australia on how we exchange data. As we move into the future and as we continue to innovate in healthcare, we see the adoption of global standards and further adoption of those standards such as the GS1 standards to be critical in what we're doing for digital health innovation in Australia. What I want to imagine in the future is a world where all data can move seamlessly from point A to point B without any intervention by a clinician or a consumer. And that's easy, I can move data today. But with global standards, I can actually move data safely. I can ensure that when a clinician in Australia or a clinician somewhere overseas is looking at the data, they're understanding and seeing the same information, that it translates locally to their own systems and they can understand how it works. With GS1 standards, that also means they can understand where that care occurred and they can understand exactly what the products were that were involved. And this for us is the true benefit of those standards. The use of these standards will help us deliver improvements in our healthcare system that will address everything from backlogs of patients waiting for care through to how do we move that care from the hospital into a consumer's home so that people can get the care when and where they want rather than where we choose for them, as has occurred historically. As we move in this 20th year of celebrating GS1 Healthcare, it is really exciting for me. The future is endless and what we are seeing today is really leading to a difference in the future.